Welcome back. You're watching Channel 1 News. Thank you for staying with us. Moving on, the government has already established 6 children protection centers across the country, which include Malindi, Garissa, Nairobi, Nakuru, Kakamega and Siaya Counties. Labor and Social Protection Chief Administration Secretary for Patrick Ole Ntutu says the centers will assist the children from abuse, violence, neglect and exploitation.
A recent report released in 2019 by the National Council on the Administration of Justice Special Task Force on Children Matters, titled The Status of the Children Justice System in Kenya, highlighted that nearly 60% of crimes committed against adolescent girls and children in 8 counties of the Republic involved sexual offenses. Kilifi County is one of the leading in that list, and it had the highest percentage number of girls and children who were sexually abused between 2016 and 2018. In reducing child abuse cases, the government and child protection. The government and child protection crusaders have set up a center constructed at a value of 11 million shillings in the region.
The CPC provide a child-friendly space that approaches child protection from a diverse, holistic angle. From the experience of already existing CPCs, there is a high demand for the integrated services provided in CPCs. The government has established 6 children protection centers in the country.
Speaking in Kilifi County during the handing over ceremony of Kilifi Child Protection Center, Chief Administration Secretary for Labor and Social Protection, Patrick Ole Ntutu, says the center will assist the children from abuse, violence, neglect and exploitation.
The Child Protection Center will serve as a hub of information and services primarily for children and the whole community. It is set within the community where vulnerable children can be protected from abuse, violence, neglect, and exploitation.
The country director of Plan International Organization, Kate Mainavoli, said the center will assist various families on issues related to childcare as a one-stop shop.
The services to be provided here will be many. We call it a one-stop shop. It will cover many issues, the risks that children face, stemming from neglect, from abuse, dropping out of school, those who require legal services, those who require counseling, and those who require reintegration with their families.
Meanwhile, Garissa Governor Ali Korane and Trustee Safaricom Foundation Barack Odero officially opened the Children's Diabetes Management Center at Garissa Referral Hospital that was constructed and equipped by the Safaricom Foundation at a cost of 12 million shillings.
The statistics are not very encouraging for this diabetes, especially diabetes among children. The statistics are not very encouraging. You have heard that out of 2,000 people who are screened, 450 among the children, 450 of them are positive. That is a rate of almost 22%. I think that is a very serious matter.
The project is geared towards creating and enhancing a program that will help support diabetes management in children.
The center that will help detect and manage diabetes among children will also serve 4 neighboring counties of Wajir, Tana River, Isiolo and Kitui.
I'm happy that there has been civic education and sensitization. 50,000 people who have been mentioned as having been educated on diabetes, and the opportunities available to avoid it is very encouraging. But we want more sensitization. We want our doctors and our health workers to go and inform our people on what they know are the causes of this disease so that we can avoid it.
According to statistics, the number of children living with diabetes is increasing by 3.5% annually.
Kumbuka utaekelea pin yako, hivyo ndivyo utakuwa umekelea bid kwenye quickbid.co.ke. Ni bidhaa bora zaidi kwenye bei ya nini?
Chini kwa chini. Chini kwa chini.
Jiunga na QuickBid ni rahisi. Enda kwenye M-Pesa, bonyeza paybill kisha weka business number 4032353. Kwenye account weka kodi ya bidhaa unayotaka na bidi yako ya chini zaidi. Kwa mfano TV 16 kisha